Hi, I'm Brandy DeBarge. I attended Notre Dame Preparatory High School in Fitchburg, Massachusetts. I am the Education and Training Supervisor for Patriot Ambulance. My office is located here in Marlborough, Massachusetts. In high school, I was really focused on medicine. I had quite a few family members that were in the field of medicine, and I had pretty much not thought about doing anything else. And so I applied to colleges and got into a pre-med program. 3 weeks before I was set to start college, my grandmother passed away, and it devastated me, and I dropped out of college. I was working full-time for Shaw's Supermarket and considering my options. During that time, as a cashier and working in the deli department, I had the opportunity to meet some EMTs and kind of inquire about what they did, and learning that maybe that's something I would be very interested in. So I decided to sign up for an EMT course. It was a year after graduation, so I was almost 19 years old. In 1995, when I was graduating, there was not many programs, so it was very difficult to first find a class to go to. And it really, opened up my eyes to the opportunities that I could have helping people, which really was my primary goal wanting to get into medicine. It took me about a month to get hired part-time, and about 2 to 3 months after starting part-time basis, I started at Patriot Ambulance in 1996. I was an EMT until 2004, and I worked full-time doing that and also full-time as an M01 dispatcher, so I could afford to go to college. Went to Mass Bay Community College for my certificate in paramedicine. The EMT program is about 150 hours minimum, depending on the course program you go to. Patriot Training's EMT course runs about 170 hours, and that's both didactic lecture and practical skill component. You basically learn all of your first aid skills, splinting, assessing patients, taking vital signs, and transporting them to the hospital. And it's a huge step from EMT to paramedic, but you do have to become an EMT first before you can go to paramedic school. The paramedic schooling involves a lot more hours, clinical rotations in OB, psych, ER, OR, field rotation on an ambulance, 300 minimum hours riding with senior paramedic, practicing all the skills that you learned, which include advanced airway management, IV skills, cardiac recognition, all kinds of medications that can be administered in the field. So there's quite a depth and breadth that's a gap you have to make between EMT to paramedic. We do combine EMTs and paramedics to work on the truck together. First, few months where you're, paramedic, you're like, hey, where are the paramedics? And you're like, oh, wait, I'm it now. So you're looked upon because everybody's going to be like, okay, you're the medic. What do we do? You have to make all the decisions, all the scene leadership. You're controlling, patient care, and sometimes multiple patients at a time, especially if we're doing multiple motor vehicle accidents. It's can be pretty stressful, but very exhilarating at the end of the day. I've been a paramedic for 15 years now, and I have another role now. About 3 years ago, I transitioned into the role of Education and Training Supervisor. I teach every day, and I teach everything EMS. So I teach to police officers, firefighters, school nurses in skilled nursing facilities. I teach everything from basic life support CPR to pediatric advanced life support courses. I teach all the continuing education for the Hudson and Marlborough fire departments, all the continuing education for Patriot ambulance. There's many different career tracks. Some people do the EMT to get to a fire department. Some do it to become police officers. Some do it to track to be a paramedic. Some do it to track to be a nurse, a doctor, a PA, an NP. There's so many opportunities within our field. And it's not just doing primary clinical work like we do responding 911 calls. Paramedics and EMTs are employed in emergency departments, urgent care centers. This was just I kind of fell into the teaching portion, never thought that my role would end up being primarily education. I always had a passion for it, and then it just became what I do. Challenging part, people can be difficult. They're not calling me because they're having a good day. As far as education-wise, I'm dealing with about 170 EMTs and paramedics that have to recertify every 2 years, so making sure they have the minimum education requirements completed. Just administratively, all the work that happens behind the scenes that people don't see can be very challenging. If you're interested in getting into this field, do it early. Look into it as soon as you can, junior, senior year. If you're going to be 18 within a year, you can start taking the EMT class now. You do have to be 18 in order to take the exam for the state of Massachusetts, the practical exam, but you can take the written exam before 18 as long as you have a valid driver's license. You do not have to have your high school completion. Some jobs do require you have your diploma or equivalent, but it is not required in all agencies. You can get your EMT certification without a GED or a high school diploma. Start early, start talking to people, make a friend in public safety, get a mentor, latch on to them. It's kind of what I did. We're constantly having to evolve and learn new things. That goes for all aspects of public safety. Police and fire, constantly learning new ways to deal with fires. So if you're looking for a career path in public safety, be prepared to never stop learning. Some skills to be a perfect candidate to be an EMT. We like people that have a general appearance of leadership, grooming. We do check, obviously, your driving record. We also check your criminal record. You have to comply with some rules, actually, in order to test. They ask before you're allowed to examine if you're a convicted felon and such, and there's a special process to go through if that might be the case. As far as your soft skills and the things that you're good at, reading, writing, we have to document everything we do for patients. You have to be able to communicate with complete strangers. So you can't really be shy, but then again, I was shy when I started in this field. So we could build you. We can build upon pretty much anybody that comes in with a good personality and a good work ethic. I would just get out there and find what resources you have available to you to explore. Your career path does not have to be a direct route from the day you graduate. And I'm clearly an example of that.